Hello, this is Real Sankara Hours. Real Sankara Hours. Follow us at Sankara Hours on Twitter. Subscribe to our Patreon, patreon.com/Real Sankara Hours. And also realsankarahours.podbean.com for our RSS feed so you can follow us. You're definitely going to want to follow us because we have another guest who's also a longtime friend of mine. We're going to be talking about COVID-19 and particularly institutional racism and how that's a public health issue for Black people, because if you've been paying attention to the news, Black people are disproportionately dying from COVID-19, particularly in places like Washington, D.C. and elsewhere throughout the country. I'm Adam Hudson. Follow me at AdamHudson5 on Twitter.
And this is Peter M. Gunn. Follow me at MGunnPeter.
And our guest, Collette, do you want to introduce yourself?
Yes. My name is Dr. Collette Harris, and I am a family medicine physician in Washington, D.C. I mostly, entirely right now, am providing care to people experiencing homelessness, and particularly with the COVID-19 pandemic, working to do screenings for COVID-19 in shelters, referring for isolation and testing for people who are living at the shelters, for them to go to isolation and quarantine sites, performing rapid antibody testing, and also seeing patients in our shelter-based clinic.
Awesome. Yeah. And how about you? So just to, I guess, full disclosure, all three of us went to Stanford University. So we have basically three generations of Stanford alum on this podcast. So it's so interesting kind of Stanford reunion on this podcast. Of sorts, yeah. An unofficial reunion, not one through the Alumni Association, but like, yeah, Collette, I've known you since college, but like,
Yes.
Can you talk about like, your educational background and particular, because you said you serve the homeless population, but from what I know about you specialize particularly in the relationship between systemic racism and health issues, right? So do you want to go into that?
Definitely. That's definitely been an emphasis of kind of all of my education and my training. When I was an undergrad at Stanford, I was an interdisciplinary studies and humanities major. And so in addition to my pre-medical courses, I took classes on like medical anthropology, race and biomedicine, the ethics and politics of public service, justice. I then went on to get a master's in nutrition from Columbia University. I attended medical school at Howard University, a historically Black university. I then completed my intern year at Howard as well, and graduated from the Swedish Cherry Hill Family Medicine Residency Program. And really, that was social justice, activism, like critical race theory was a significant part of my training there, and worked at community health centers during residency and post-residency in Seattle. I worked at Seattle Indian Health Board as my continuity clinic in residency, and then at Carolyn Downs Family Medical Center in Seattle, which was founded by the Black Panther Party back in the 60s, prior to coming here. So that's a little about my education and training, and I'm board certified in family medicine.
Sweet.
That's a lot better than what I did when I lived in Seattle, which was just work at a pizza place. But
pizza feeds us.
Yeah, so all three of us read. So I'll just jump right in. So Van Jones, who, like, he's a CNN contributor and host, but he has he used to be a Maoist at one point. So, which
I have my doubts about that.
He used to be like a little more radical. Anyway, so he wrote this piece a CNN op-ed. He wrote it April 24th, 2020. By the way, we're recording this episode April 29th, 2020. So the title is, I'm someone COVID-19 could easily kill. Here's what I am doing about it. So basically, he got a lot of pushback, but he's talking about like the health factors within the Black community and why that makes us more vulnerable to COVID-19 deaths. And his main point is like he's trying to make two arguments that contradict each other. So he said the government needs to take more responsibility for ending the structural systemic racism on full display right now in our healthcare and economic systems. And then he said Black people need to take more responsibility for our individual health choices. And so this is basically like the sort of old argument that, hey, the reason why you Negroes are dying is because you eat too much fried chicken and all that soul food, and that is why. So, what do you guys think? Like, what's your first impression like when you read it, or what he said?
Van Jones is falling off, man. It's this almost reads like a parody of the kind of thing he would write, because he makes like his actual point about how the health problems Black people face in America are the product of systemic racism, which is like very obvious to anyone who's paying attention. But then he's like, but what if like let me just read it. He says, Black influencers set the agenda for global culture. We can make the quest for personal health as cool as we have made the quest for personal wealth. Imagine if rap videos and Black TV shows started showcasing push-ups, Peloton, and healthy green drinks in the same way they often showcase fashion in foreign cars.
So bad.
And then he goes on to like talk about what Jay-Z and Beyonce and Diddy and Common, the great leaders of the Black community, amongst others, what they've been doing. I mean, he probably has like some sort of healthy thing he's trying to sell, and that's probably why he wrote it. But this is just
right.
Like, oh my God, right. This is new lows even for him.
I mean, I think that the rhetoric around behavior changes and healthier choices is problematic because it really ignores the structural nature of the problem. I think that the behaviors are really limited by access. So your choices about your health are really limited to what is accessible to you. And there exists a racialized access to healthy food, safe housing, jobs, healthcare, clean air, green spaces to exercise. Like we know that Black people are disproportionately exposed to air pollution. And so I think that, he says, I abuse my body through stress and overwork. And I would really argue that capitalism, colonialism, and racism abuses the Black body and not his personal choices.
Yeah.
And like you said, like, oh, you're eating too much fried chicken. I don't think we're dying from coronavirus because we eat too much soul food. We're dying because food apartheid and environmental racism, having jobs that expose you to occupational hazards, violence, incarceration. All of these injustices cause chronic medical conditions. Like that's why you see disproportionate numbers of high blood pressure, high cholesterol, diabetes, respiratory conditions in the Black community. And then you combine that with the implicit and explicit bias within the healthcare system. And then you see the disproportionate suffering in the Black community from COVID-19.
And something else he said, I want to pop up this quote because because here's the thing was like so weird about this article, and this is kind of, I think, apropos of Van Jones. It's something he likes to do. He's trying to like sort of carve out some sort of nice little middle ground position on this, and
right.
And he works for CNN, so it's like this is sort of very typical within their ideological line. But so he says like, yeah, like we have challenging jobs that pay less and da 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 da. And then he says there are other factors as well. many traditional quote-unquote black foods boast much more cholesterol and sugar than the U.S. Food and Drug Administration recommends. And to some African Americans, healthier choices like adopting a plant-based diet, exploring meditation, practicing yoga, etc., may seem culturally alien. And it's like, okay, so he's basically saying that there's something intrinsic within black culture that makes us eat shitty food. And one of my reactions to that is like, okay, so that means white culture is somehow healthier. But I don't know, I've seen plenty of unhealthy white people.
Right. And I think that's the problem just with like how like medical textbooks and medical education, how it presents like racial differences. Like it will either present them as genetic, which we know is false because race is a social construct and not a biologic one. It is not genetic. Or it will say that, you know, this is cultural, this is behavioral. So there is like an inherent pathology within the black community or within black culture, and ignore the like systematic oppression that is causing these differences.
Yeah, I mean, he's really doing something pretty criminal in the way that he's like he doesn't really even lay out the exact case, because I know that the neighborhood I grew up in Columbus, Ohio, which has extreme economic and racial disparities, like the infant mortality rates, you know, are on the level of third world countries. That's not a thing that can be solved by doing yoga and drinking green juice. I mean, it's absurd.
Yeah, even even where I live, Pittsburgh, California, which is like a post-industrial working class, mostly non-white area, like we live not too far from an actual dump, like an actual waste dump in my neighborhood. It's like so there's that, and also we also have high rates of asthma, and also in Richmond, California, which is for those of you who don't know, Richmond, California is on the other side of the bay from San Francisco. So like there's San Francisco, on the other side is Oakland. Richmond's further north from Oakland. So Richmond has a major Chevron oil refinery, and they have like notoriously high rates of asthma. Like basically, like if you're a young, and it's a mostly poor, low income Black and Hispanic community. So I know because I work there at the community college, and it's in Richmond, it's literally normal to basically have like high rates of asthma because of the environmental pollution from the oil refinery.
Just I think of a very anecdotal example, if I may.
Yeah.
My dad, he worked in a glass factory for 28 years. The glass factory eventually closed several years ago because complying with EPA standards was deemed too costly by the owner. He was exposed to all of the chemical ingredients that are used to produce glass. He would be, ladling glass on a hot furnace platform, and he was diagnosed with a lung condition. He had recurrent sinus infections, like joint aches and pains. He recently, and my dad, he is, very healthy, works out pretty much every day of his life. And he recently went back to have follow-up pulmonary function tests. And I think the factory closed in 2016 now. And now, so many years later, as a much older man, his pulmonary function tests were completely normal now. And I think that just seeing that has really, and growing up, really, even though when I was growing up, I didn't really have the vocabulary to explain what I was seeing, that just really informed my practice, I think.
Yeah, I mean, that's also a very good point, that there's this sort of systemic disparities and underdevelopment, and then there's also just capitalism itself
Right.
that grinds workers that are disproportionately black, under its heels.
And we'll get into so I'll close off the discussion. Well, I'll wrap up the discussion on the article, then we can get deeper into the nitty gritty of racism and public health. But so like this is one of the things, like when I first read this, because I saw it on a friend's Facebook page, and there's like a lot of back and forth and shit. And one thing that, I mean, I'm not a doctor, so like this, my knowledge is limited. But also, you know what? Van Jones is not a doctor, and he didn't. That's why we have an actual doctor on our podcast to have a rebuttal to someone who's not a doctor talking about COVID-19. Anyway, what I found, there was something about this article just from a writer's perspective that he was basically assuming a level of authority that he does not have. And from what I know so far about COVID-19, or about viruses in general, it's COVID-19, and this is something we mentioned in our first podcast about COVID-19, it's a very new virus, and it transmits at a very fast rate that we're not used to, and that's why it's basically, that's why the entire country of Italy basically shut down for weeks on end. So this is a virus that our bodies are not immune to yet. Hence the whole weird conversation about herd immunity, which seems kind of ridiculous. But our bodies are not immune to it, right? So it seems like, just from a observer's perspective, the only way that how this can be fixed, quote unquote, is either by a vaccine or antiviral treatment. In the same way that like our bodies over time became a little bit more resistant to the flu. And so when it comes to the flu, it's like, okay, every season you get a flu shot, and then you're immune to the flu, and it's not going to knock you out. There is no vaccine for COVID-19, and there's no publicly available, at least as far as I know, widespread publicly available antiviral treatment. So it seems like without those two things, any kind of advice to treat COVID-19 is sort of like, we're just trying to do the best we can with a bad situation. But the way Van Jones sets up his argument is that he's basically saying, without openly stating it, but the way he's laid out is that, like, hey, if you just take Jay-Z and Beyonce's plant-based power couple, like, nutrition diet, or P. Diddy's partnership with Ariana Huffington to promote sleep meditation through audible.com, Commons vegan whatever.
No, he's a pescatarian now. You can't.
So he's basically saying, like, hey, if you follow these steps, you black people, you can basically be immune or protected against COVID-19. And nowhere in his article does he mention vaccines or antivirals. So Collette, I wanted like your perspective as a doctor. Like, do you think the way he's laid out this argument, like, is he making a remotely good argument?
I definitely think that it seems like he is conflating like transmission and contracting COVID-19 and like the risk factors for like worse outcomes if you were to become sick. And like you said, like green juice, yoga, like that's not going to prevent you from contracting COVID if a COVID infected person coughs on you and you touch your mucous membranes. Like there's a difference that I think is a little muddied in the article.
Yeah. I guess the way he goes about it, his out is saying to create a pandemic resistant black community, whatever that means.
Yeah.
Mm-hmm. But if we were to broaden this out, if we were to do that, I mean, if that were really the task, wouldn't we need something like, I don't know, universal health care?
Yes.
Yeah. I mean, like again, it seems like without a vaccine, we're doing our best to manage a situation that's just bad, right? Like, I mean,
Hmm.
yeah, and Colette, can you like what have you seen when it comes to treating patients in DC? Because I think I remember you shared there are some numbers about like the deaths of like it was going by like deaths of COVID-19 in DC, and like the number of Black people's deaths was like incredibly high. So like what have you seen like on the ground when it comes to treating people?
Hmm. Um, uh, well, I think that, like, our, I think it goes back to, um, like, the risk factors that I think are very much due to the systemic injustices that we see.
Mm.
So, there was, I think, very concerned about our patients who are experiencing homelessness, because
Mm.
not only are they living in a congregate setting, in a shelter, without like private rooms, without the ability to physical distance, if you're living out on the street, not having access to sinks or soap and water, also because of racism, because of poverty and food insecurity and food apartheid and not having safe housing, um, like they are more vulnerable to poor outcomes
Mm.
from COVID, and so um, that's why we've been like trying to go in and like identify people who have concerning symptoms and essentially like get them out of that shelter, and refer them for like isolation and testing, to kind of prevent the spread. It's just a population that is um, like experiencing like structural violence like pre-pandemic,
Mm.
Yeah.
and so it's just like a setup for disaster.
Mm.
Yeah, that seems. Yeah, I do want to, I guess, go into that a little bit more because
Yeah.
the like homeless or houseless populations are, yeah, there's it's like getting it seems like getting any sort of medical care is extremely difficult in the first place.
Hmm.
And so then also from what I've heard, in about sort of what homeless shelters are like, it does seem like they're disease breeding grounds.
Right.
And there is a picture, I don't know if you saw it, but in Las Vegas they like painted giant
Oh.
like
Right.
6 foot body size spaces on the concrete, um to allow people to sleep on the street while practicing social distancing, which was one of the most cursed like America images I've seen in
Right.
a while.
Right.
But it's interesting, I guess, how the like public health, people make the argument that like, oh, we shouldn't give homeless people homes because I don't know, it removes the incentive to work or something. I don't actually know what the argument is, but cities don't want to do it. But it seems to me like putting that solving the problem that way is like the only responsible public
Right.
health outcome.
Right. No, I agree. I completely agree with like housing is healthcare,
Mm.
and I believe in housing first.
Mm.
And if I were in charge, everyone would have housing, or at least everyone experiencing homelessness would have a hotel room during this pandemic. I think that is the most, I think that's just the most humane and most appropriate public health decision that could happen at this time. I know that DC has been trying to place people who are more medically vulnerable in hotel rooms so that they can practice kind of self-quarantine to prevent them from exposure to COVID. I think that more can be done.
And let's move on from Van Jones, because I think we've all agreed that he's full of shit. And let's go at the meat of because I think what I was talking about before we started recording is that when I think particularly, and this seems like a very American thing, and I want to emphasize it seems very American because in America, it's a very individualistic culture compared to other countries, I think. And normally when we look at health, it's like, oh, the reason why you're unhealthy is because something's wrong with you. Let's say if you have a mental health issue, it's because you yourself are crazy. It's not maybe the world around you that may be bad or something wrong with it. There's something wrong with you. Or if you have any kind of physical ailments or physical illnesses, it's something that you as an individual did, not the world around you. So, I'll ask that. What do you think of that mindset in terms of how in the United States how we look at health? That it's just an individual thing. It's individuals we're removed from whatever factors and forces of the world around us, and our health outcomes are only determined by what we do. And if you are sick, there's something wrong with you, and you need to change your personal behavior. So, what do you think of that mindset in terms of how we, I think, view health?
I guess I think that it needs to change completely because it's false. It's a false narrative. We all exist in this world together. We all exist in the environment around us. And I think that individualistic perspective prevents us from, like you said, having socialized healthcare. People are demanding, they want to go back to life as normal. People don't want to participate in, the lockdowns and the stay-at-home orders because, they're bored or they want to get back to life as normal. It's very self-centered, I think. To change.
Yeah. I'd like to, I guess, go further into what are the problems of public health in a capitalist society where it seems like there are so many incentives against just even the very concept of public health.
Right. Well, I think that capitalism, the more I practice, the more I'm convinced that capitalism is really incompatible with public health. You have people who, if, for example, looking at COVID, people who are unable to stay home because they have to go to work, or their healthcare is associated with their job. They have healthcare through their employer, so they have to continue working. If they don't work, they'll lose their income, they'll lose their healthcare, they'll lose their housing. Really, everything is prevents us from practicing appropriate public health measures because it's all about profit and not about people.
Yeah. I think I have to limit my, how much I pay attention to this for my own sanity. But one of the things that struck me is, sort of in the way, they say like Katrina was not a natural disaster as much as it was a social disaster. It's a product of neglect and corruption and all that stuff. And I feel like in many ways, this is like a social pandemic where like half of it is the disease itself and the other half is the sort of, insane, not just Trump, but, 40 years of neoliberalism, basically removing the state's ability to act. I guess my question is like, for someone who is, on the front lines, how has it been like having to follow, like you have to somewhat pay attention to that circus, to just so like what you're going to do the next day. Right?
You mean, like,
or like how
well, I don't listen to anything Trump says.
But I mean, like, maybe not him specifically.
I just don't listen to him.
but I mean, like, it breaks down even to, like, everyone was, the New York media, I guess, was going gaga for Cuomo, but he was, doing major mistakes. But yeah, I guess, like, it goes all the way down to the local level because there isn't, like, a national response plan for it. Right. So, yeah, how is it dealing with that, I guess?
I mean, I do think that is it is stressful, like, to hear, that states and local governments are, like, competing for PPE because there's no, like, nationalized coordinated response. Like, knowing that is, like, an additional stressor, I think, being on the front lines. But, like I said, I try not to listen to him.
Yeah, none of us do.
Right.
Yeah. Well, I think, I mean, like, I think, Peter, what you were saying about the circus, I think, from what I took from that, it's not even just Trump, but it's like, even if you don't have to pay attention to Trump individually, because he's the president of the United States, he basically sets the tenor for the political landscape, for better or for worse. Yeah. And our sort of collective political consciousness revolves around just basically the brain of a buffoonish gargoyle, right? Like, so, like, and so, yeah, because it does. I mean, because what we're talking about, like, because there's this lack of a coordinated response. I mean, you can draw to two factors. One, we do not have universal nationalized healthcare like the rest of the industrialized world. And two, we did not have a coordinated central government response to the crisis compared to countries like South Korea, Vietnam, and also New Zealand has done a better job of beating back coronavirus. I mean, not in terms of not in terms of curing the virus, because again, there's no vaccine, but in terms of managing the severity,
flattening the curve.
Right. Yeah. Yeah. So, so I guess from what you're saying, Collette, because there has been no coordinated national government response, and a lot of that is due to Trump, because I mean, his administration refused to take the WHO test and administer tests nationwide and do the certain kinds of steps that other countries have done who have been able to manage this crisis a lot better. Is that fair to say? It's because because of the lack of government response as a result of the Trump administration's mismanagement, it's made your job harder?
I think so. And I just think, like, I cannot remember which country this was, and I had read, like, if you know that if there's a stay-at-home order and you know that the government is going to, like, deliver food and deliver supplies to your door, like, that, like, enables you to, like, comply with these guidelines. And so I think even without Trump in the picture, going back to what we were saying about just, like, American capitalism being incompatible with public health, like, I think that we really would need a society that could have that kind of, like, social support so that people could stay at home.
Mm.
Do you see?
Right. Yeah.
Yeah.
Mhm.
Yeah, and that's basically where we're at right now, especially with the I mean, the other circuit that's going on is in Congress when it comes to these stimulus checks, which apparently, by the way, there's so far we're only going to get one check. It's not like going to be monthly checks. We're only, yeah, which like who the fuck is going to survive on $1,200 for a one-time payment in 1 month that a lot of people have not gotten yet? Like,
yeah, because that is the other problem, is then, like, exactly what you said, is that if we were in a situation where the government could manage the economy for even a month, where, you know, it would be much easier to do all this stuff. But, you know, we've now seen that the forces of the market are literally at odds with public health. Like, it's a complete and total antagonism.
Mhm.
And I don't, you know, it's kind of insane to me. And I think then about, right, like, the problem is not just getting the vaccine, because we could, you know, somebody in Cuba will probably synthesize a vaccine before some pharmaceutical giant in the U.S., but we wouldn't take Cuba's vaccine, and we would have to wait until the pharmaceutical giant can, you know, synthesize it and then patent it and then be able to distribute it profitably and all that stuff. And the whole thing is just
And you'd have to have insurance to pay for it, and if you didn't have insurance, then you couldn't get the vaccine. And
the one thing I was wanting to thread is the relationship between systemic racism and health. And, like, there is a quote by Nina Turner was on what's that show, The Rising, on the Hill with the she was she says she made a very sharp point. I'm paraphrasing what she said, but she said basically being black in America is like a public health issue, or being poor in America is a public health issue. Like, just living as a poor person or a black person or an indigenous person or a person in any kind of, you know, if you're at the bottom of the social, economic, and political ladder, you're kind of in a state of endless pandemic. So as a doctor, Dr. Harris, who specializes in this, could you explain explain how, you know, being black and being poor is basically a public health issue regardless of COVID-19 and the pandemic we're facing now?
Well, I think it goes back to really understanding that, like, blackness is not, like, inherently a risk factor, because race is a social construct, that there's nothing, like, inherently pathologically wrong with being black. The risk factor is the racism that is experienced. And again, like, really everything that we can do to be healthy has been racialized throughout our history. Just housing, jobs, food, access, exercise, outdoors, you know, every access to healthcare, and then our experience within the healthcare system and our experience with medical providers, history of like medical experimentation, all of that, like, contributes to poor health and to like, that is how racism is a public health crisis, even prior to COVID-19.
And can you go into the medical profession? Like, in a sense that like
Mm-hmm.
how does like within the medical profession, how
Mm-hmm.
do they um how do they view black people as people, and also like how do they treat black people? Because I've heard like stories of black patients being like, you know, not having like adequate health care from health professionals.
From
So
providers, right?
yeah, so
Um,
can you go into that, like how?
Definitely.
Yeah.
They there was a study recently, I think a few years ago. I think it was the University of Virginia. Don't quote me on and it like interviewed um, like medical professionals, I think medical students, and about um, like their views of their black patients, and even among medical professionals, there were kind of false um, preconceptions about like black people and the experience of pain, or
Mm.
having like thicker skin, or like blood clotting differently. Like there were like false beliefs about black people, um, even among like the similar views among people who had no medical training compared to people who did have medical training.
Mm.
And I think that that is very concerning, because if you're a medical professional, if you're a physician or you're a nurse, has these views about, you know, black people don't experience pain similarly, um, then you know, people's pain is going to be inadequately treated, or
Mm.
you know, they may not get the intervention that that a white patient presenting similarly would. I think that there's also been studies that like race concordance with patients and providers having better outcomes when a patient feels that their provider looks like them and they can relate to their provider,
Mm.
that will promote health. Um, and so that's been a passion of mine as well, has been um, like recruiting more people of color and more black people to the medical profession.
Yeah, the issue of pain I always find fascinating, because it goes back like literally all the way, you know, because the argument back in the day for using African slaves was that Europeans just couldn't withstand it. They couldn't withstand the conditions, and it was like, and you know, it's, even though from what I remember reading somewhere, there was like the average life of someone in a Haitian sugar plantation was 3 years, but somehow it's like our bodies were sturdier, and there it even gets to like, you know, I don't, like, because I guess people view white skin as like more visibly bruising, then like they don't see, it doesn't show up in, you know, I'm sure there's many problems with that assessment, but that's sort of the like colloquial idea. And you know, also just literally having to hold the pain of racism for, you know, 400 years, and being able to like, you know, seeing the ability to withstand that as, you know, almost a symbol of strength. It seems like all of that collides, like, you know, 400 years of history collide like in the emergency room.
Mm-hmm.
Yeah, even as someone who's covered police violence for a couple years, what you're saying about black pain, like you see it even in coverage of police violence, like, you know, the descriptions of black victims of police violence, it's like, I mean, like Michael Brown, or there's this idea that black people can't feel pain, and so
Mm-hmm.
when you shoot black people, then it's like, oh, they don't feel pain, and so it's like, it's a way of dehumanizing black people. So like when people react to black death, it's sort of like it's seen as less tragic.
Mm-hmm.
And one thing I noticed, like I wrote a story years ago, but when you were talking about how the medical profession reacts to Black patients, it actually made me think of this, because I was interviewing a couple mothers whose children were killed by police, like Black mothers who lost their young sons. Yeah, a lot of them were sons, to police shootings. And I remember talking to one mother, and she said the reaction from therapists, like mental health professionals, like they just didn't understand it, because a lot of mental health professionals were white, so they had no idea when it came to dealing with police violence. Whereas if you're Black, you know, like that's because of the reality of systemic racism. The idea that just because you're Black, your life could be snuffed out by the police and there could be no justice, we've been conditioned to treat that as something as normal. And so someone who's white, like doesn't like they don't really experience that. And so she was telling me that amongst her therapist, she said like it was hard to relate to the therapist because she just didn't the therapist couldn't understand, because you know the mother had to go through therapy just to deal with the grief of losing her kid by police shootings. And she was saying like she was saying a lot of mothers had very, very similar experiences, that the particularly mental health professionals, when it came to treating people who lost their loved ones to police violence, they were just inadequate, because it's I think they would get questions like, well, are you sure the police meant to do that? Like just sort of like questions that were like very clueless, but it shows like how like there's some actual.
Can you imagine being in a therapy session and getting like the cross examination?
Yeah.
Oh my God.
Yeah, and but yeah, like and there are some. I think Erica Garner. I remember I met Erica Garner before she passed away, but one thing that's come up is that a lot of Black folks who lose their loved ones to police violence, some of them die of broken hearts and grief, and just the stress of
the stress.
Yeah, yeah. But it, like what you're saying reminds me of that, like how deep the systemic racism, even within the medical profession, how deep that is.
No, I agree. I think just thinking to what you were just saying, like going back to like risk factors, just like the very stress of being Black in America and the stress of experiencing racism is a risk factor for poor health in and of itself. And I think that many, when we're talking about mental health, like you said, I think having a provider who you can relate to is very important in like all medical specialties, particularly mental health, because I think so much of our mental health challenges like are rooted in racism and our experience with racism. And so having a provider that can relate, I think, is really critical.
Yeah, I'm sure. Well, I don't. Maybe they updated it, but I don't think institutional racism was like in the DSM, you know, for a long time. So there literally just like wasn't even the capability to discuss it.
Actually, yeah, that. Oh man, this is going on a tangent, but and we got like 6 or 5 minutes. But I do remember when I went into therapy, when I had to take a mental health break from graduate school, because I was just dealing with two completely separate worlds: the graduate school and my Black working class roots, and just the inability. Like, it was just hard to relate with the institution of graduate school. And just bounce between two different worlds, like, actually caused a lot of anxiety and stress for me. So I had to just leave. But I do remember my therapist. She was saying the thing she was pointing out. She was like, "Okay, yeah, you're literally dealing with institutional racism, and that's linked to your anxiety.
Mhm.
Like that, she literally said that like last year, but it seemed like a new thing, I
Mhm.
guess. Like, yeah.
Or I think. Oh, go ahead.
Oh, I was just gonna ask, like, do you think the medical profession? Do you see any parts of the medical profession updating their practice to address those realities, or?
I do think that they're like in the like clinics and places that I've worked, people are thinking about this and talking about like trauma informed care and intergenerational trauma.
Mm.
I know there's also been talk about, I was just thinking of like your experience about like my experience with like imposter syndrome
Yeah.
within the medical profession. And I think I've seen much more discussion. I think previously it was like, oh, you feel imposter syndrome because that's just how you feel. And I think now people are thinking about it in terms of like you experience imposter syndrome because people are treating you like you're an imposter because of being a woman in this space. So I do think that like, and again, I think I've been privileged to be to like work in places and practice in places that have this understanding. I don't know that that is like the general understanding from the medical community as a whole.
Yeah, I mean, the things that the medical community used to believe a while, even not that long ago. I mean, do you know, I don't know how long ago it was, but I think it was even in the 70s when they still tried to like make an actual argument that black people couldn't swim because our bones were too dense. It does seem like there's a long way to go in that regard.
Right.
And
go ahead.
No, I was just gonna say if you had anything else you wanted to address.
No, I don't think so. I think we covered everything.
Yeah. Actually, I'll ask this just to wrap up, but I'll just address this like maybe our listeners who are concerned about. I mean, I think this COVID-19 pandemic is, I think, hit us all with like a massive collective shock because it's very surreal. It's something that does not happen. It's like one of those once in a century things that like, oh, there's a pandemic that knocks out the entire world and we all have to be quarantined. It's like, like even with the Spanish flu, like there's like very, 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 very few people in the entire planet who are alive who've experienced the Spanish flu pandemic. So, for people who are at home and feeling hopeless and want to do something, not just about COVID-19, but also the disproportionate deaths of Black people and other marginalized people of COVID-19. Like, what do you think the average person should do, especially to support medical professionals like yourself? Like, I mean, should people be like maybe donating masks, or is there anything like collectively that people can do to address this?
I think that's a really great question. I know that I'm living in DC right now, and so I'm part of the DC Mutual Aid Network Facebook group. So I know there's like mutual aid groups within communities, like local groups, like all over the country where people can get involved in terms of helping people like meet their material needs with food and services during this time. I think I've had a number of friends and coworkers, like past coworkers, sending me like sewn masks, fabric masks, for me to be able to distribute when I was doing the screenings in the shelters. So I think that people should like look to these groups locally to see how they can get involved and see how they can help people within their local community.
Perfect. And We got only a few seconds, so I'm just gonna cut it right here. Otherwise, TriCast is gonna shut us off. So, Collette, thank you so much for coming on Real Sun Car Hours.
Yeah, it was a real pleasure.
Yeah. All right, so we're gonna be out in 3, 2.